I thank the ranking member, and I think he knows, as we have been friends for some time, we have the same goals. There may be policy debates. We hear, oh, this group doesn't care, that group does care, and I care more than you, and all this type of stuff. The bottom line is, this committee would not have even been formed if we didn't care.
Right.
That's why this select committee was formed. So weed through all the stuff you may have heard today from many ways. Our goal is to be prepared next time. And you know what? Next time, we may have a pandemic that affects kids more than adults.
Correct.
And how are we going to be ready for it?
Correct.
And that's really what we're after. We have 2 years to do this. It's a short time, and there's so many topics to cover. So I hope that as we go through the process, understand the things that were mentioned we need to talk about. We plan to talk about all those. What programs are actually working? It's our job for oversight to decide how much are we spending on things and where is the money going and is it actually having a return on investment? Because that's a smart thing to do.
Of course.
So, you hear things today like, oh, you don't like these guidelines. As I said to you, the guidelines that I questioned you about as being accepted, I agreed with them. I didn't have a problem with them. That wasn't the issue. So I hope that you can see that we are working towards finding the process, understanding the process, make sure that we can do things smartly in the future. That's my goal. That's why I wanted to accept this job when asked to take it on by the Speaker. Look, my family, I've got teachers, and I can tell you, I know my teachers from kindergarten through 8th grade. I still know their names. And I still get together with my 8th grade teacher. They mean a lot to me. Even at my age, he's still hanging on. But, so we, over and over again, like we heard implied that I was against those things. I wasn't. I just wanted to understand the process. And we've had hearings here with the school nurse associations
Yes.
represented, and we've had good discussions. Now, one of the things you said, though, is you saw much less transmission in the schools. And so me, as a scientist, as a doctor, I'm like, well, then why are you wanting to base things on community rates? That didn't make sense to me. So these are questions we want to get to the answers to. And what data was used, and why did you come to these conclusions? The data give us better choices. It did. And so, you mentioned a couple of things that I would like to put into the record, if we can. The written guidance from the medical experts that you talked to, I think it would be good if we got something from them for the record to hear.
Well, I certainly can give you their names.
Okay.
I think that I think a lot of what we did, sir, was we did orally. But so I will give you their names,
Okay.
and if I can find the written guidance, we will find it, of course.
Whatever you can do, or whatever they may want to submit, and maybe they can
Sure.
recall what they put together. And I think that would be helpful. You mentioned the Cuomo Commission, and that you had your suggestions, guidelines. I'd like to have that as well, things that were there for reopening. And you did mention that you weren't asked by the previous administration. And that's fine. Maybe that's another lesson learned that, look, we're looking at who are the groups that were asked to weigh in. Okay, well, was it helpful? Was it not? This is where we are right now. And so these are legitimate questions. So you got the Cuomo Commission. I know you stated that you had contact with Dr. Walensky, and so I would hope that that was submitted to Dr. Walensky, who did ask for your input. But let me just share something here from Hawaii, and it's an exchange between reporters and our governor in Ohio. And the reporter is saying that Governor DeWine, speaking during a hastily called televised briefing, noted that almost every school district in the state agreed to resume in-person classes by March 1 in exchange for teacher vaccines. But he said Friday that a handful of schools where vaccines have been distributed, including in Akron and Cincinnati, have indicated that they will renege on that agreement and delay reopening. Governor DeWine said that while anyone who wanted the vaccination in Akron schools has received one, school administrators there aren't planning to resume in-person learning until mid-March. Governor then was quoted as saying that's not acceptable either. Governor's remarks came hours after an announcement by the Federal Centers for Disease Control and Prevention that there's strong evidence in-person schooling can be done safely as long as masks, social distancing, and other strategies, though not necessarily teacher vaccinations, are put in place to protect against COVID-19. So when I read these things, you know, it seems to me fair to want an explanation as to why several large public school districts in Ohio refused to open in March of 2021, despite having vaccines distributed, thus compelling the governor to take the extraordinary actions to compel them to open. And I just bring up this story because it's there for further discussion. These are the things we want to look back on and ask ourselves why. Why did some schools not reopen? They have the right to explain themselves, but this is where we need to go so that we can be wiser in the future.
Mr. Chair,
and as I said, this is my closing statement, and we're finished.
Yeah.
We're finished.
Sorry,
okay?
because
okay.
I could explain Cleveland.
Well, we can talk about that later. You can
Okay.
send me a letter. This is where we are with the committee, and we're having votes. You know, but this is my closing statement. What I'm saying is that's what this committee is supposed to be about, and I hope it can be that way throughout the rest of it, because we're going to be doing this for a while. So questions will come up, and you can feel free to answer that to me in writing, and I would appreciate that.
Thank you.
And with that, I would say that this hearing is adjourned, and without objection, all members will have 5 legislative days within which to submit materials and to submit additional written questions for the witnesses, which will be forwarded to the witnesses for their response. If there's no further business, without objection, the Select Subcommittee stands adjourned.
Thank you.